Hi there, in this video, I'm going to show you some simple home remedies that you can use to pink eye. These remedies are all natural and easy to follow, so stick around and I'll show them to you right now. Everyone has been there. You fall asleep one night and your eyes look and feel good. The next morning, you awake with an inflamed, red, and painful eye. You most likely have conjunctivitis. This illness, often known as pink eye, can be caused by allergens such as pollen and hay. In other circumstances, a virus or bacteria is to blame. Viral pink eye is often caused by cold symptoms such as upper respiratory congestion or a runny nose, says nurse practitioner Shaneeka Rice, CNP. Bacterial pink eye develops when dirt or debris enters your eye. Perhaps your hands are unclean and you wipe your eye, or you come into contact with someone who has it and then touch your face. Pink eye home treatments. In general, you can manage pink eye symptoms or side effects until the infection runs its course. However, the sort of pink eye you experience decides which therapy may provide relief. Drops for the eyes. A good approach is to hydrate your eye with over-the-counter artificial tears or saline drops. The irritation from the eye could be because it's dried out, Rice says. Alternatively, it could be attributable to your environment, such as dust from heating/cooling systems in your home. It normally helps to relieve your eye if you moisten it. If your pink eye is caused by allergies, antihistamine drops may also be beneficial. Rinses with cool water. Cool or lukewarm warm water rinses or compresses might help relieve eye strain. Avoid heat if you have itchy eyes, Rice advises. Heat aggravates the itch. When you experience irritation, you should rinse with water that is lukewarm and tepid. Medications available without a prescription. If your eye is inflamed, acetaminophen, Tylenol, or ibuprofen can help relieve some of the pain. Medication for allergies, such as Zyrtec, may also be beneficial. Pink eye treatments to avoid. Rice advises against putting anything in your eyes unless you've first spoken with a healthcare expert. This also applies to pink eye and other eye-related conditions. Mother's milk. You may have heard that placing breast milk in your eye is healthy due to the antibodies it contains. A 2021 study also discovered that a drop of breast milk could be a beneficial treatment for breastfed newborns with eye discharge who are less than 6 months old. However, Rice claims that there is no statistical evidence that breast milk is an effective treatment for pink eye in adults. It could possibly aggravate eye issues, she warns. Antibiotics for pink eye caused by a virus. If you get pink eye, you might think you need medications right away. That is not always the case, unless you have the bacterial variety, which is less prevalent. Most people only identify pink eye with bacteria or believe that if they get pink eye, it's due to a bacterial infection, Rice adds. However, viral pink eye is the most prevalent type we observe. Antibiotics are not appropriate for viral pink eye, just as they are not appropriate for other viruses you may contract. So, if you have viral pink eye, there isn't much doctors can offer for therapy other than the previously indicated supportive care, cold compresses, or eye rinses. Moisturizing eye drops, and waiting it out. Is it possible to get rid of pink eye overnight? Pink eye caused by allergies can go away rapidly if treated with antihistamines and other appropriate care. However, bacterial and viral pink eye do not go away overnight. If you don't take an antibiotic, bacterial pink eye grows worse over time, adds Rice. It depends on how your cold symptoms go with viral pink eye. If you have a cold with congestion, for example, your postnasal drip may leak down the back of your throat or through your ears or eyes. If your sinus congestion is particularly bad, you'll have discharge from your eyes because it has nowhere to go, explains Rice. That will take days to heal. How long does pink eye take to go away? Cold symptoms normally linger around 2 weeks, whereas viral pink eye usually clears itself in 5 to 7 days. Bacterial pink eye also lasts about 5 to 7 days if medicines are taken. When should you consult a doctor for pink eye? There isn't much you can do to treat viral pink eye other than wait it out. However, there are situations when consulting a doctor is necessary. Without an antibiotic, the symptoms of bacterial pink eye worsen over time. Typically, you'll have a red and inflamed eye, as well as some eyelid swelling, Rice adds. You will also have a thick, yellowish or greenish discharge and crust that does not improve over the day or over a few days. At any moment during your illness, viral pink eye might progress to bacterial pink eye. Any form of debris or dirt that gets into your eyes might cause bacterial pink eye, Rice says. If you have eye redness, pain, or irritation, you should see a primary care doctor or get express care. I frequently hear, "I woke up with my eye crusted shut, I believe I have pink eye," Rice explains. However, that is not the case. Everyone wakes up with some crust on their eyelashes. She says that there are numerous causes of ocular redness or discomfort. If you've recently turned on the heat, the air in your home may be dry, or air conditioning may introduce dust into the air. All of this can lead to the formation of crust in your eyes, Rice explains. That does not always imply that you have bacterial pink eye. However, if you have eye pain or vision problems such as blurriness, double vision, or loss of sight, you should seek medical attention immediately. These could be signs of something catastrophic, such as a stroke or brain tumor, or they could be symptoms of something else. Your eye could have an abrasion or a scrape, Rice explains. A subconjunctival hemorrhage occurs when a vein ruptures in the eye. You usually don't do anything about it. It can, however, appear quite frightening.